My name is Henrik Zetterberg. I'm a professor of neurochemistry at University of Gothenburg and at University College London. My specialty is fluid biomarkers for Alzheimer's disease and other neurodegenerative dementias. It's a disease process that starts much earlier than we thought just 10 years ago. And then the disease process is involving more and more of the brain tissue and neurons, other cell types of the brain. And the one interesting aspect of biomarker research is that throughout the years, we have been able to develop more and more biomarkers for the different disease processes that kick in different stages of the disease. So the biomarker studies in longitudinal cohorts of people who might have entered the cohort study with normal cognition. Then approximately, if you follow the patient, these individuals for a long time, 20 to 30% will develop some type of cognitive impairment. And if they have given biofluid samples and done neuroimaging at distinct time points during this phase, and we may measure these different biomarkers, we can sort out what the sequence of events in Alzheimer's disease is in humans, in the people we want to treat against the disease. And then it has become really clear that amyloid aggregation is the earliest biomarkable pathological change during Alzheimer's disease. So this starts 15 to 20 years before you get Alzheimer's dementia, which opens up the possibility of preventing this from happening, of course, especially with amyloid targeting drugs. So one could have normal cognition, but if you're amyloid positive, according to CSF beta 42/40 ratio, or amyloid PET, but CSF comes a little bit earlier, and the blood test can also mark this to some extent, but not as well. But then you have the amyloid pathology. When plaques form in the brain tissue, the surrounding cell types will react to this pathology, but it takes a little while. So a few years later, neurons start to phosphorylate and secrete tau, and then that's when they start to enter a little bit of a neurodegenerative phase, and this is induced by the amyloid, it seems. It's never the other way around. And then astrocytes and microglia get activated. And that first astrocytic and microglial activation, almost all biomarker data suggest that if it's effective, then that is a protective response. So some of these macroglia and astrocytic markers, they go up as a sign of efficient microglial or astrocytic activation. And those who get that type of efficient increase in these biomarkers, they seem to stay non-demented longer, although they have amyloid, than their counterparts who do not respond as strongly against amyloid. But eventually these amyloid plaques, they will grow and they will spread, and you get more tau pathology in surrounding neurons. The astrocytes and microglia get exhausted, and eventually this biomarker signature of astrocytic and microglial activation goes away. And when that happens, that's when you're close to a neuronal network breakdown that will give you the clinical expression of the disease, which then is short-term memory impairment, but also other cognitive problems. And patients who are demented from Alzheimer's disease, they look almost normal in their astrocytic and microglial markers in spite of growing amyloid pathology and growing tau pathology and neurodegeneration.